Hi, my name is Amy Boyer. I worked together with Carrie Coleman to create a presentation on differential reinforcement of alternative behaviors. First, we will go over what differential reinforcement of alternative behaviors, or DRA, is. DRA is a reinforcement schedule that reinforces positive behaviors while ignoring the targeted problem behavior. The positive behaviors that are being reinforced, also called the alternative behaviors, are behaviors that serve the same function as the target problem behavior. This is important because the alternative behavior should eventually take the place of the problem behavior, making the problem behavior no longer present. Next, we will tell you step by step how to implement a DRA intervention. First, you need to identify the problem behavior and come up with a clear definition that can be understood by anyone who might observe the behavior. This is crucial to creating an intervention that is effective, since anyone involved in the DRA needs to know exactly what behavior should not be reinforced. Second, you will need to identify the function of the behavior. You can bring in a behavior analyst to run an official functional behavior assessment or functional analysis. Knowing the function will allow you to determine what alternative behaviors can be reinforced instead of the target behavior. Third, you need to make sure the acceptable alternative behaviors have been taught to the individual. If these are not behaviors that the individual already has in their skill set, you may need to come up with a program to teach these behaviors first before moving on to the full DRA. You will also need to make sure you have a clear definition of these behaviors so everyone involved knows what behaviors they should be reinforcing. Fourth, you need to come up with a list of reinforcers and a plan for distributing them to the individual. These should be specific to the individual and their needs and interests. Some examples are social praise, small treats, extra time doing a preferred activity, or tokens that can be exchanged for a larger reward. Fifth, make sure everyone involved with the implementation of the intervention has been given proper training and understands DRA and how to take data. They should understand the target behavior, alternative behaviors, reinforcement schedule, and what kind of data they should be taking. Finally, after all of that has been done, you can implement your intervention. Differential reinforcement is a very versatile intervention and can be used in a variety of settings. It's great for a school setting. As long as the alternative behaviors are being reinforced more than the problem behaviors, there should be a decrease in problem behaviors. This allows for some human error, which is likely in a classroom full of other students. Before creating your DRA intervention that will be used in a school, you need to decide who will be in charge of implementing the plan. This could be teachers, aides, other professionals, or even parents. You will need to decide if other professionals, such as behavior analysts, will be brought in and what their role will be. You need to decide what tier the DRA will be focused on. We focused on Tier 2 and Tier 3. Tier 2 focuses on small groups or individual classrooms, whereas Tier 3 focuses on individual students. Finally, you will need to have a clearly laid out training plan in place before beginning an intervention. I will now go over the basic format of our school-wide plan. We will have paraprofessionals, general education teachers, and special education teachers implementing the plan. The special education teachers will be the main source of implementation. We will bring in some outside professionals. We will use BCBAs and other behavior specialists to help perform functional analyses or functional behavior assessments when needed for individual students. They will also help us to determine the functions of behaviors within classrooms. They will help teach alternative behaviors that are not yet mastered by the students, and they will be here to provide support to staff year-round and provide annual trainings. We will use DRA for Tier 2 and Tier 3 interventions. Tier 2 includes small groups and classrooms. The DRA will aim to reduce problem behaviors that are seen in multiple students within that setting. Tier 3 covers individual students. We anticipate this will be where DRA is most commonly used in our school. It will aim to decrease problem behaviors that the individual student is exhibiting. We will look into using a DRA intervention on a case-by-case basis. If a teacher or parent is concerned about a specific student, that teacher, the parents, and a behavior specialist will sit down together to go over the student's IEP, discuss the behavior of concern, come up with some goals, and determine if DRA should be used. A similar process will be used for individual classrooms or small groups. That classroom or group will be evaluated, all involved parties will meet together, and a plan will be written. Reinforcement will be individualized for each student or classroom. We will focus on using token economies, which involve giving out a token for engaging in the acceptable alternative behaviors. The tokens can then be traded in for larger reinforcers. Teachers will help determine what reinforcers will be most effective for their classroom and students. We will determine the effectiveness of interventions by analyzing data. Teachers and paraprofessionals will take frequency data using provided clickers. This data will then be put into the computer to be analyzed. If we see that the behavior is not decreasing, we will consult with the BCBA, who will help us to determine if there are issues with treatment fidelity or if a new treatment plan needs to be drafted. We expect parents to be very involved in the process of creating an intervention. We will consult with them to discuss the behavior, future goals, reinforcers, and the intervention. They will be required to give consent before we begin any intervention plan. We will also provide parent training to try and create consistency between expectations at school and in the home for the student. It is important that our staff feels as though they have the necessary support to implement effective plans. The district BCBA and our school administration will be available year-round to answer questions, address concerns, and provide additional training. Professional development will take place over the summer before our intervention plans are implemented. This is where we will do full training on procedures with our staff. In-services will go on throughout the year to increase communication and make sure concerns are being addressed. We will have at least one staff meeting per quarter. This meeting will focus on looking at the data to determine if plans are being effective. This can include looking into classroom changes, such as better grades, more homework getting turned in, or it can look into school-wide changes, such as how many referrals are coming into the office and counselor, if fewer students are spending time in detention or in school suspension. If positive changes are not being seen in some areas, we will look into those plans and what changes need to be made. The parent training we provide will be done in 2 sessions. At session 1, we will go over some basic concepts, such as what a behavior is and how to define it, what positive and negative reinforcement are, what reinforcers are and how to choose reinforcers, what reinforcement schedules are, such as token economies, frequency ratios, interval ratios, and how to provide reinforcement for each schedule. Finally, we will go over what differential reinforcement of alternative behaviors is so parents understand the intervention we will be using with their children. We will then send the parents home with a homework assignment to come up with 3 behaviors, define those behaviors, and come up with some alternative behaviors. At the second session of parent training, we will split the parents into groups of 3 or 4. The groups will start by going over each other's behavioral definitions and the alternative behaviors that they came up with. Next, they will act out the behaviors. One person will play the student, one person the teacher, and the other person will observe. The observer can give feedback on whether or not the person playing the teacher appropriately reinforced behaviors or ignored behaviors. Finally, we will end with a discussion where we all come back together and parents can ask questions and get clarification. The materials needed to implement a DRA are pretty simple. For our plan, we will need tokens. These can be specific to the classroom or student. Examples are beads or marbles, tally marks on a board, beans in a jar, or pieces of paper. We will need the larger reinforcers that the tokens can be traded in for. These might be small toys, treats, or books. These can also be things such as an extra 5 minutes at recess or a preferred game during gym. A clicker will be needed to keep track of the frequency of behaviors. Data sheets will be used to record the data and track progress. Here is an example of a blank data sheet. You can put the student's information, what behaviors are being tracked, the interval if you are keeping track of intervals, and how many times the behavior has occurred. Finally, we will need a few training supplies. These will include training videos, a selection of scenarios that our staff can role play, and mock data sheets to practice taking data and analyzing it. That is our presentation on differential reinforcement of alternative behaviors and an overview of our intervention plan. Thanks for watching.